Welcome to this lecture video where we will be looking at white blood cells and platelets. It'll be a little shorter video this time, so let's get started. Let's start by talking about white blood cells. These are known as leukocytes. These are the only formed element that has nucleus and cell organelles. And you might remember that they made up only less than 1% of the total blood volume. Their main function is to act in the defense against diseases and pathogens. They clear foreign material, waste, and pathogens. White blood cells are classified based on whether they have granules in cytoplasm or not. So, what I would like us to do next is to look at the different types of white blood cells that we have. Remember, they represented only about 1% of the entire blood volume. So, let's have a look. So here we have these white blood cell types grouped based on the fact whether they have granules in their cytoplasm or not. And let's discuss each of these just briefly, starting with the neutrophils. So these are the most numerous ones of the lot. And if you look at their appearance, their nucleus has multiple lobes which stain dark. And if we look at the granules in the cytoplasm, we can see that these are pale red and blue in color, but there are definitely granules, as we can see. These are especially involved in immune defense responses. Let's look at the next one now. Eosinophils have well-red granules in the cytoplasm, but their nucleus, which stains dark, is made of two lobules, if you wish. So we describe them as being binucleate. These white blood cells, eosinophils, typically act against parasites. This next one, basophils, are stained dark with binucleate appearance and purplish-black granules in the cytoplasm. These play a role in inflammation responses, and we might use antihistamines to control this response if it is over-the-top allergic response. So both eosinophils and basophils often have a role in allergies. Now, let's look at the two white blood cell types that do not have granules in the cytoplasm. First, lymphocytes. These lymphocytes are the second most numerous type of white blood cells. And we could describe them as having a large spherical nucleus and a thin rim of pale blue cytoplasm after staining. They are responsible for antibodies and immune responses, and they are named based on the site of production: T cells for thymus and B cells for bone marrow. Finally, I want to say a couple of words about monocytes too. These have a kidney-shaped nucleus with abundant pale blue cytoplasm. Again, notice no granules in the cytoplasm. They play a role in eating materials that should not be present, so engulfing them. So now that we have looked at all of these white blood cell types, I want to do something else with them. Let's organize them in an order of how common they are. Does that sound okay? Here we have it. And this is important as we are analyzing leukocytes and trying to remember which ones were the most common ones. And I have a trick for you that may help. Look at the first letter of each of these when placed in the order of how common they are. When I look at this, I see a mnemonic. Never let monkeys eat bananas. So that might help you a bit. I do want to mention quickly a few words about the production of white blood cells. We call this leukopoiesis. This is simulated by two types of chemical messengers from red bone marrow, interleukins and CSFs, which stand for colony-stimulating factors. And your textbook provides a nice discussion of the production and a really good table too. So I'll leave it to you to review that independently. I want to mention here leukemia, which refers to the overproduction of abnormal white blood cells. Abnormally low white blood cell count, then again, is referred as leukopenia. So that's all I wanted to say about white blood cells. We should finish off with looking at platelets, just briefly. So platelets are cytoplasmic fragments of megakaryocytes. They have a blue staining outer region with purple granules. And the main function of platelets is to act in the clotting process. They do this by several chemicals, such as serotonin, calcium, enzymes, ADP, and platelet-derived clotting factor. So what they do is to form a temporary platelet bug that helps to seal breaks in the blood vessels. And they age really quickly, lasting for only about 10 days. So that completes our review of the formed elements found in the blood. And we will wrap up this video here. I'll see you at the next one.